for having me participate today. And also thank our Executive Director, Amy Whitcomb-Slemmer, who's sitting up here, for giving me the opportunity to speak with you all today about immigrants and healthcare. There are a lot of ways that what Marisa and Natalicia, right, have spoken about kind of interact with access to healthcare. But first, I just want to give a little overview of who we are at Healthcare for All. Have any of you heard of us before? Great, great. So we're a nonprofit consumer health advocacy organization, and the focus of our work is doing policy advocacy on the state level to increase access to healthcare. Our mission is basically to create a system that is a consumer-centered system that offers quality, affordable healthcare to all residents in the state, especially the most vulnerable. And we include a lot of immigrant communities in that population, particularly with communities that have limited English proficiency and other folks that have been discriminated against over the years. The other piece of work that we do at Healthcare for All is we do outreach work, education work, letting consumers in the state know what their options are for healthcare. And we run a helpline, and I have some postcards here, so if you have any friends, family members, anyone who has questions about what their health insurance options are, please, feel free to take some cards, hand them out. We have a toll-free helpline. We have counselors that speak English, Spanish, Portuguese, and by chance one of our Spanish-speaking counselors also speaks Italian. So we offer that service as well. And we do partner with a lot of organizations, and we did actually a big campaign reaching out to small business, primarily Portuguese-speaking and Spanish-speaking business owners, and we did partner. Brazilian Immigrant Center was one of our partners in that project, and we partner with, we have someone here from the Mirror Coalition today. We partner with them a lot on the advocacy work as well. So thanks everyone for all the work that you're doing too. So I just wanted to give a brief overview of what we've done here in Massachusetts with regards to access to healthcare for immigrants and for the residents of Massachusetts as a whole. Talk a little bit about the Affordable Care Act, Obamacare, National Healthcare Reform, whichever you want to call it. We're reclaiming the name Obamacare, so it's okay to say. And then, talk about some of the disconnect between what the Affordable Care Act was trying to do and what is being offered to some subset of immigrants on the federal level. So I'm sure you're well aware that in 2006 in the state we passed a health reform law that has been successful in increasing access to nearly 98% of the residents in the state. Of course, that's not a static number. We hear from people every day who kind of fall through the cracks or are transitioning to different health insurance options. One of the things we also recognized was that there is a subset of lawfully present immigrants who the state refers to as aliens with special status. We don't really like that name, but who gained access to healthcare coverage along with other adults who couldn't get Medicaid or don't have employer-sponsored insurance, but were low income and could get through the Commonwealth Care Program, which many of you probably have heard of, get subsidies to purchase healthcare. And so that was kind of a commitment that policymakers made back in 2006 to treat this group of lawfully present immigrants the same way as either naturalized citizens or U.S. citizens in the state. We had a fight with that, though, a few years ago when the state was seeing big budget constraints. It was 2009. The recession was in full force. And this group of immigrants was eliminated from Commonwealth care coverage. Wholesale, said we don't have enough money for them, we're just gonna, well, that was the argument at the time. We're just gonna take this whole group of people who have been entitled to this health care for 3 years out of the program. Despite our best efforts, that did happen, but we partnered with our in-house legal team, Health Law Advocates, to file a lawsuit against the state. And we actually cited the Equal Protection Clause under the state constitution saying that you cannot do that. Legal immigrants in the program have every right to the same type of health care as U.S. citizens do in the state. And it was against the Constitution to remove them from the program. So just this past spring, this population again was reinstated if they're income eligible and otherwise eligible into the program. And we're very happy with that outcome because we just saw that as blatant discrimination against a population for no good reason at all. So basically, that's what we've done in the state so far, and I think, we're very well positioned in the state, and policymakers have expressed a commitment to protecting healthcare for all our residents in the state. Things are going to change when we're moving to the Affordable Care Act, not necessarily in a bad way. Things are just going to be a little different, and believe it or not, it's going to be very difficult to reconcile our state law with the Affordable Care Act. Even though the Affordable Care Act was modeled on what we've done here in Massachusetts, there are going to be a lot of changes. One of our biggest priorities is keeping coverage affordable for our residents and maintaining the gains we've made as a state. But another thing I just want to mention is, the vision of the Affordable Care Act is expanding healthcare coverage to all residents in the country who have not had access to affordable healthcare before, and putting in some consumer protections that we have actually put in our state law in the past. It also expands the ability for legal immigrants, so the same kind of population that I was talking about before who were eliminated from Commonwealth care, to be able to get premium and cost-sharing subsidies to purchase health insurance. One of the disconnects, though, is you've heard of the Dreamers? So I think Natalicia was talking a little bit about this population, kids who came here when they were young, under age 16, previously undocumented, and this is kind of a way to give them a lawfully present status here. Unfortunately, this population, which is going to be referred to as deferred action, so deferred action childhood arrivals, are not going to have the same benefits of the Affordable Care Act as other people with a similar status. So it's basically a subset of this deferred action status that are being discriminated against and aren't going to be able to benefit from the new healthcare law. And that is a very disappointing disconnect that we see. And especially in the context of immigration reform on a broader level, if you're trying to create a pathway to citizenship, or a pathway to eventually citizenship, but lawful presence in the shorter term, these folks should have the same rights and responsibilities that other people in the country have. And we're not saying at this point that they should necessarily be entitled to better care than other people. They should just have the same access to care as everyone else, have the same rights and responsibilities to purchase health insurance under the new law. And frankly, it would be better for the nation as a whole if more people were able to access healthcare. It broadens the pool, hopefully with lower costs in the long term. And it also is a big positive for public health. You want to keep your friends and family, your community members healthy. So I think that's just kind of one of the big things that I'm seeing, as I don't know much about the immigration reform proposals that are out there so far, but I just see it as a big disconnect if you're giving some rights and benefits to people as they're trying to get citizenship and not others. It just doesn't seem right to us, and we would love to work on that with anyone who is interested. I'm going to end now, but I'd also just put a plug in if anyone wants to take some of these cards, or if anyone's interested in learning more about healthcare for all, the work we do, or interested in getting involved with us, just let me know.